I became an Iasis neurofeedback provider in hopes to help my own son who suffered pretty greatly with severe OCD.
I use it for traumatic brain injury patients. I use it for patients with anxiety, patients with depression.
Chronic pain, post-traumatic stress, post-traumatic brain injury, OCD. We also treat a lot for peak performance.
I get the cases where they've seen all their regular doctors and they're just not getting anywhere. We need everything that we can possibly get to have an effect on these very difficult cases.
To become a licensed practitioner, it was pretty smooth sailing. We went out to the training. It was extremely organized. When I left, I was pretty much very comfortable and confident to provide the treatment. It could be a nurse, a doctor, maybe somebody a psychologist. There's some acupuncturists involved.
We're talking about a treatment to the brain. The brain controls everything. So it's sort of easy to understand how this could be applicable in almost every clinical situation that you have to deal with.
Most of my patients come from word of mouth. It's not uncommon for a parent to bring a child in, and within just a couple treatments, child number 2 is in the chair, and perhaps child number 3, and then mom and dad to follow.
Patients began to inquire about it, and we started using it in all kinds of other applications. I have to say, even under my best of care, and I've been doing this for 40 years, even under my care, they would not have gotten better without this treatment.
Our youngest patient is 4, our oldest is 90.
It's so easily tolerated and so non-invasive, I wouldn't hesitate to use it on any person with any illness in any kind of condition.
It is probably one of the most rewarding things I've done as a nurse.
I could make a living doing something else, I'm sure, but I'm in it to make people better. People don't get better, I'm not happy.
It does my heart good to help people. And then, of course, there's the financial end of things, running a business and being able to be profitable. I actually had to devise a family plan based on the need and the requests from the patients. So I try to focus on just healing the patients, and the rest seems to just follow.
It's another tool in my toolbox, and this is a real valuable one.
Standing behind the chair for almost 3.5 years, I can tell you that I'm changing the lives of many families.
These Iasis neurofeedback treatments have made such a dramatic difference.
You better be ready to change some lives.